Hi, my name is Miley, your Miss Northeast Junior High United States 2021, and this is More Than a Birthmark. Welcome to More Than a Birthmark, the web series featuring individuals with birthmarks to raise awareness and share some fun facts about this amazing community. My name is Miley, and today we are changing things up a little. Instead of an individual with a birthmark, I am joined today by Dr. Denise Adams, a leading expert in the field of vascular anomalies and director of Comprehensive Vascular Anomalies Program, or CVAP, at Children's Hospital of Philadelphia. Thanks so much for joining me today, Dr. Adams.
Look at you. You look beautiful.
Thank you.
How's everything going?
Good, good. Sunday.
Yeah.
Rainy, but that's fine, The weekend has to come to an end somehow, so
Yes.
here we are.
Yes. So how have you been doing?
Oh, I've been doing pretty good. I mean, my leg was being a little weird last night, but it's fine. Just put my compression stocking on,
Okay.
classic stuff. So I didn't get to ask, how are you doing?
I'm doing great. I was just on a little vacation sort of last week. It wasn't really a vacation. I worked every day. but at least
laughing.
but at least I got to see my family. So yeah.
Where was that at?
That was in Ohio, so in Cincinnati. Yeah.
So I just want to start by letting the audience know that Dr. Adams is not only a director of the Comprehensive Vascular Anomalies Program at the Children's Hospital of Philadelphia, a pediatrics hematologist, oncologist, and professor I can't speak, of pediatrics at the University of Pennsylvania Perelman School of Medicine. She is also my doctor. So I am so honored and happy to see you agreed to speak with me today and help me with my series, Dr. Adams. Thank you so much.
You're welcome.
Before this interview, I was looking online at all of your academic and professional honors online. And I just need to say again how extremely lucky I am to be able to have access to the expertise and incredible care of physicians like you. Can you take a moment to share with our audience a little bit about your background and how you ultimately came to CHOP in 2020 as the director of the Comprehensive Vascular Anomalies Program?
Yes, well, so this all started about 20 years ago. I was in training for pediatric hematology oncology. So that meant that I was already a pediatrician and I wanted to take care of patients with like blood disorders or cancers. And I was at Duke University, which is in North Carolina. And I had a clinic the same day as a dermatologist had a clinic, so a skin doctor.
Yeah.
So this was when I was still in training, and he sent me patients with vascular anomalies. And 20 years ago, we really knew nothing about vascular anomalies. And so what I did when I got these patients, because I was very confused and they were diagnosed with the same diagnosis, and I couldn't understand why they looked so different and how could they have the same diagnosis. And I didn't understand the best way to treat them because there weren't a lot of things out there to treat them. So I went to the library because we didn't have the internet then, that was 20 years ago. And I became friends with a librarian at Duke who every month would copy me all the latest articles in vascular anomalies.
Wow.
So then I went to Boston Children's because there were experts in the field. So a person whose name is John Mulliken, who is a plastic surgeon. And this scientist, and his name is Judah Folkman, he's not here with us anymore, but he started the whole theory of something called angiogenesis. And that is how blood vessels recruit or make other blood vessels. And so they really took this medical person under their wing as surgeons and taught me about vascular anomalies. And so I started a big program when I was in training at Duke. And then I was recruited to Cincinnati Children's Hospital, which is another one of the big hospitals. And I stayed there for a long while. And I started a program in vascular anomalies there. And then the Boston people recruited me back to Boston to start what we call clinical trials. So how best to help kids and adults with vascular anomalies in a way that we can prove that medicines and other things work for them. And so I went to Boston, and then CHOP recruited me to help them with their vascular anomaly program. So I guess you can call me, I like to build programs, and I like to build programs not just with myself, but with other people, because I think it takes a boatload of people to build a program. It's not just one person that can do that, but I like to bring people together to do that. So that's why I came to CHOP.
Right. And what first sparked your interest in helping children with these types of conditions?
Well, that was really because I, was taking care of kids with cancer, and it's sad when kids have cancer, but we have a lot of medicines for kids with cancer, and we have a lot of protocols. So if someone comes in with a certain diagnosis, we know right away what the best options are for those patients. And it frustrated me when I had very sick patients come in with vascular anomalies, and I felt like I needed to treat them, but we didn't know how to treat them. And so that's what sparked my interest in kids, because that's where it all starts, and it's because it's congenital problems. But then that's why I really felt like I needed to focus on vascular anomalies, because there weren't a lot of treatment options out there for patients with vascular anomalies.
And I really appreciate that, because I've heard many stories of other people I've interviewed with birthmarks that are like older than me or like an adult, and they would say how when they were younger, they didn't have anything really, they didn't know anything really about their condition and how to like treat it. And some of them were telling me how they had like 20 surgeries or like crazy amounts, and I'm thinking like, I am honestly just like so grateful to have you. So thank you again for that, honestly. My next question is, the CVAP program at CHOP was recently launched under your direction as a cutting-edge program to help find treatments and cures for children with these rare tumors and malformations of the vasculature. I don't know if I said that right. Can you share with our audience the types of conditions that you treat as part of this program?
Yeah, so it's really interesting, and I don't know if you knew this, but did you know that today is Rare Disease Day?
I did.
Yeah. So vascular anomalies are rare diseases, and so I think of it as sort of like an umbrella. So here's the umbrella, and the umbrella is vascular anomalies, and then underneath the umbrella are tumors. So vascular anomalies can be tumors or malformations, and tumors are things that grow. So the most common vascular anomaly that's a tumor is something called a hemangioma. And hemangiomas are benign, so they're not cancerous, and they're, well, you can call them birthmarks, except they go away, but they usually are on the skin in the head and neck area. And children get them shortly after birth, and then they grow and they stay the same, and then they go away. But there are other more serious tumors that are actually considered cancer, that young infants can get. So some of them are called, a very long word called caposiform hemangioendothelioma. And I started this because of a patient that I saw when I was at Duke with one of those tumors. And I really felt that there was not a lot of scientific investigation of how to treat them, and we needed to investigate that. And then on the other side of things, again, because we have this big umbrella term, so there's many, many different diagnoses under this, are the congenital problems that kids can have. And they can be broken down into slow flow vascular malformations. So slow flow, you think about like your veins, you think about your lymphatics, or high flow, and you think about your arteries or your capillaries. But you have to remember that you can also have combined lesions. And kids that have malformations, although a large percentage of them are local, but some, as you know, can be very diffuse and can cause issues with pain or interfere with vital structures. And some of them can actually be life-threatening. So it's really important that we understand the difference. And even though I say it's an umbrella term, we can't just lump them all together, because you have to know what you see. And that's like the phenotype. And we talked about that, because we have to take what we see and know how best to treat them.
Right. And I know actually quite a few people with hemangiomas in the vascular, the VBF community, because as you said, it's common. Just like there's a lot of port wine stains. Yeah. So yeah, I've seen quite a few people with that. And my next question is the Comprehensive Vascular Anomalies Program is made up of experts of all kinds of disciplines, from interventional radiologist, gastroenterologist, I cannot say that, cardiologist, and surgeons to physical and occupational medicine specialists, social workers, and genetics. Why is there such a big team to deal with these types of conditions?
Well, this is are complicated types of conditions that need almost every single specialty in pediatrics and the adult world, right? Because we always forget about the adult world, and we know that you all become adults, right?
There's a lot of
So,
people.
right. And so we need to start thinking about the adult world as well. But sometimes vascular anomalies can affect the lungs. Sometimes they affect the blood, and that's why, hematologists, oncologists are involved. Sometimes they affect the GI tract or the skin. And so every single specialty really needs to be involved. And that includes things like sports medicine, because sometimes you can have a vascular malformation in your joint area. So for our comprehensive program, and also the programs that I helped set up in Cincinnati and also in Boston, we have a core group of people. So our core group is the hematologist oncologists, the interventional radiologists, some of the surgeons, and some of the support staff, like we need nurses, we need physical therapy, social work. And then, so that's our core structure. And then we have identified a person in every single specialty, because we don't want someone coming to CHOP and them going to, say, a gastroenterologist and us saying, you have this diagnosis, but then the gastroenterologist saying, oh, you have a hemangioma. So we have to make sure that all of our specialists are trained in the care of patients with vascular anomalies.
Right. And I know that like my condition affects me in like many different ways. And so like as you said, you don't want one person telling you one thing and then another person telling you another thing, because that's very confusing.
Right.
And then you're like, so yeah, that definitely makes sense now. Not to make it all about me, but when I was a little over a year old, I was diagnosed by Dr. David Lowe, one of the plastic surgeons who was part of the CVAP, with Klippel-Trenaunay syndrome. I am not an expert, but I've tried to explain to my audience about my condition. Could you take a moment to explain what Klippel-Trenaunay syndrome is?
Yeah, so you have to remember that way back when things were being described, because they're so rare, what would happen would be physicians who were seeing vascular anomaly patients would have like a group of people that looked the same. So I've explained this to you before, but when we look at people, we look at what our clinical exam is, we look at what the radiology is, and we look even at what the pathology is. And so physicians got together and said, hey, you know, there's a group of patients and they have these characteristics. And a lot of times that got named after the person that was describing them. So Klippel Trinane, so Dr. Klippel and Trinane, described patients that had capillary lymphatic venous malformations. So they're combined lesions, and usually they have a slight capillary malformation, so something you can see in the skin, a deeper component that's an abnormality of the veins and an abnormality of the lymphatics. And typically, whatever extremity is involved with that, you have a little bit of overgrowth, meaning your muscle or your fat in that area has overgrown. But there's a lot of overlap. So no one patient is the same. And that's a little bit of the problem that we've been having. So sometimes people can have that, but they also have more veins than they have lymphatics. And sometimes people can have more lymphatics than they have veins. And so I think the most important thing is to really describe what the problem is with the vessels that you have. And as a physician, to know what the risks are for you so that we can help follow you better and know what else is what other opportunities there are for treatment.
Right, and like everybody is affected differently. Like,
yes,
if you one person come in and have this problem, and then someone else come in and have something else, even though it's like the same thing, because
right.
especially with Klippel-Trenaunay syndrome, there's a lot of things that it can affect. And I know quite a few people that have told me like different things from their perspective and how it affects them.
Yeah.
Some people ask me if my condition can be passed to my children. My mom and I read that many vascular anomalies and associated conditions are because of a somatic gene mutation. What does that mean?
Mm-hmm. So those are really good questions, and I think things that people are worried about. So to me, and this is very simplified, very, very simplified. So, because a genetics person would be much more comprehensive. But to me, there's two ways of thinking about things. You have genes that are inherited, and those are inherited from your mother or your father. And if you remember, they're inherited from your sperm from the male or the egg from the female. And those are genes that actually are in every single cell in your body. So we talked about this. So the thing that's out there at Christmas time, the 23andMe and Ancestry.com, which you can actually send off for, and it gives you information about what is inherited. Where are my ancestors from? Do I have green eyes? Do I have brown eyes? Am I prone to high blood pressure? Am I prone to other things? Those are germline mutations. So those are inherited. And it's very important because those basically can be found if you spit into a cup, because in your saliva, you have a lot of cells that are there, or you can figure out that information from getting a blood sample, or you can get a skin biopsy. When someone has a somatic mutation, we all are different looking because we have genes from our mother and our father. But we all basically look the same because you can see us. We have heads and we have arms. We have teeth. You just smiled. I can smile too, right? So we look the same. And those processes that make us human beings are processes of growth and development. And so we have processes in our body that makes a cell become a muscle cell, a cell become a fat cell, a cell become a blood vessel. And as we're developing, it was nothing your mother or your father did. Sometimes in a certain area, you can have changes in the genes just in that area. And so for you, you had changes in the vessels that were in your leg. And that's a somatic mutation. So that change is not going to be found anywhere else except for where the malformation is. And the deal about it is that change is very, very small. So the frequency of that gene is really small. So we can't find it in your blood, and we can't find it in your saliva, though we're working on that. But right now we can't. It's not like an inherited gene. You have to do a biopsy to find out what that is. And that helps us, as you know, because you underwent that, because that helps us link your diagnosis to now a genotype, to a somatic mutation that might help with treatment.
Right, and yes, I do remember getting a biopsy for my last surgery, which was,
Yeah, I think it was
2020. Yeah, I'm just making sure because I'm not sure. Which is only my second one, but I do remember getting that biopsy. Sorry, I have like a thing with blood, so that's why I just thought of blood for a second. Anyway.
Yeah, don't think of that while you're sitting there.
Yeah, not a good idea. But at one of our recent visits, you explained to me some really cool information about the genetic component of my condition, which is, I think, when we got this. I would love if you could please share a little bit about your knowledge about the genetics behind these conditions and some new treatments on the horizon.
Yeah, so this is so exciting. This is really, really, really exciting because because we had an idea that was called a hypothesis that a lot of vascular anomalies were caused by these somatic mutations because there were only a small number of them that were hereditary. So there are some like venous malformations that are hereditary. There's some capillary malformations that are hereditary, but a small, small number. So scientists started thinking, well, if there's only a small number of germline, so that's the hereditary mutations for vascular anomalies, there has to be somatic mutations. And so they started looking at tissue that people were having done, because a lot of times when people have overgrowth, they have what's called debulking procedures where you take off some of the tissue, and they started looking at that tissue and they found some somatic mutations. And genes are kind of funny because genes always produce a product, but sometimes a mutation causes a gene to make too much of that product. So you remember there's a sort of a step-by-step process. And so the gene that is common in probably about 60% of vascular malformations is PIK3CA. And that is an important part of a process that makes a cell become different cells. So there it is. It's right up at the top there. And then, yeah, right there. And so if you're making too much of that gene's the leader of the pack. And so you make too much of the next gene underneath it and too much of the product of the next gene. And that means that in that one area, you make too many blood vessels that are not normal. And so if we can have a medicine that we know of, and this is what we do in oncology all the time we do this. We have somatic mutations. They're different. The somatic mutations in cancer are different than the somatic mutations in vascular anomalies. So if we know what the somatic mutation is, then we can block that area in oncology, and we can do the same thing for vascular anomalies. But the deal is it's only in that area where they're what we call upregulated, that they're making more of. So it should be fine for the rest of your body, but only affect the area where there's overgrowth. So there have been some newer medicines. So when I was in Cincinnati, we started the use of something called sirolimus, which is at the bottom of that pathway. It's an mTOR inhibitor. And that was incredibly helpful for many, many patients that had no other opportunity, or no other, opportunities for any treatment, really. But we wanted more. We wanted something that was a little more direct. And there is a drug company called Novartis, and there was a French doctor who did what I did with sirolimus, who had a patient that came to see them. And we call that the power of one, Molly. So when one patient makes us think and makes us make a difference. So that happened with the drug sirolimus, and it happened with this drug alpelisib. And this physician in France, his name is Dr. Canode, he had a patient that came to see him with something called CLOVES syndrome. He Googled CLOVES syndrome because he was a kidney doctor. He didn't really know what it was. And he saw that it was a problem of that PIK3CA gene. Then he Googled PIK3CA inhibitors and found alpelisib. And then he started a trial, and then he was a scientist. So we also made something called a mouse model to see if it worked. And this drug worked in his mouse model. And now in 2 months, we have a study, a formal study. So we have a smaller study now for pretty life-threatening patients that need this medicine. But now we're going to have a study in about 2 months for other patients with this medicine. And it's great for me because in oncology, I'm used to patients having an opportunity to have a whole list of drugs with different side effects. And that's what we need for vascular anomalies. We don't only need 1 or 2 drugs. We need a whole list of drugs that are going to help them and have minimal side effects.
Right. And honestly, like I said, there's a lot of people out there that have to get surgeries a lot because they don't have these medicines available to, all of them yet. And they don't, I know you were talking about a topical cream as well. But if we're able to get that, it can make life a lot easier, I think, for everyone, all over the world with these conditions, because I know a lot of people have to travel like really far to get these surgeries and these, and it takes away from like their daily life and, some people that are younger, like their education when they're going to school. So I honestly can't wait for these medications and the topical cream. It's just going to be so much easier, I think, for everyone.
You were talking about like all the procedures that people have and things like that. And I think it's important for everybody to know that like these medicines are going to be very helpful, but we're still going to need procedures. So we still will need our surgeons and our interventional radiologists. But the other really cool thing is that what I'm hoping is that we will take these medicines that we know work and will deliver them to the areas that have the malformation. So it's called drug delivery. And so in that way, you can decrease the side effects of the medicines. And we're actually working on that at CHOP through some expertise of one of the oncologists who's very, very interested in helping us with drug delivery for vascular anomalies.
So my next question is, if someone listening today would be interested in coming to the CVAP program for treatment or some of this amazing research, how can they get involved?
Well, they can, so if they want to learn more about our program, they can go to our website. And then on the website is a number that they can call. We have 2 ways that we help people out. So one is that we actually see patients, right? Because there's nothing better than seeing patients. But in this world of COVID and with people coming, needing help from all over the country, and even other medical professionals needing help, because we talked about how sometimes even medical professionals don't need a little more information. Every Wednesday night, we have a conference, and the conference is used for our patients to review who's coming to clinic the next week. But then the latter half of the conference is used for new consults. So if someone wants their case reviewed and can't come to our clinic, we can review them in this Wednesday conference. It's a little It's not an official meeting because we don't actually physically examine someone. We don't even do a virtual visit, but
Right.
we look at the clinical scenario and we look at pictures, we look at the radiology, and then we make some, it has to be physician to physician. So it has to be the physician that makes the referral. But then we get back to the physician and we give them our recommendations.
Right. And do you have, or do you accept adult patients in the CVAP? And if not, can you recommend a similar program for adults?
That is a very, 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 very good question. So we are trying to, and I say we, because there are centers all across the United States, and we know that we need to transition our patients into the adult world. And so we are actually working on that. So there's a group in hematology oncology called so we have a special interest group in vascular anomalies where we are starting to educate adult providers. So there's a big meeting called the American Society of Hematology. It's called ASH. And we gave something called a platform presentation where we talked about that. We talked about the need for adults to be involved in this. And myself and a geneticist from Brussels went over cases with them so that we could get adult hematologists and oncologists interested. At CHOP, we do see adult patients. A lot of the pediatric hospitals will see adult patients to a certain age. So we will see people of any age in our clinic for a consultation. But in order for patients to get treatment from us, we probably go to the age of 40. And what we try to do is have an adult counterpart help us with treatment. So for example, these new studies go up until the age of 60, and we will see a 60-year-old patient, but we will have an adult hematologist or one of their local doctors be available and work with us in taking care of those adult patients.
Right. And now this is a little bit off about what we were just talking about, but not really. As you know, I love fun facts, and I learned in my research that before you became a doctor, you went to a nursing school. What inspired you to go back to medical school after becoming a nurse?
Well, so it's a long story. So I applied to college for pre-med and got in pre-med, and then had second thoughts about how long that would take and all of that. So I went to a college that also had a nursing school. So I went to Georgetown. And so I switched to the nursing program. But then when I was there, I started working at a free clinic in Washington, D.C. And the free clinic was run by a physician. And she said to me, "Why don't you just be a physician?" So then after I graduated as a nurse, I did pre-med courses and applied to medical school. So I wasn't a nurse for very long, but it was great because I actually did wind up working at NIH while I was applying to medical school. And I worked with Dr. Fauci for a year, which was just amazing. Yeah, I'm sure he does. He would never remember me because it was just 1 year, but it was just an amazing experience. And then when I was in medical school, I actually worked to pick up some hours to make some extra money when I was in medical school as a nurse. So, yeah.
Yeah, that is really cool, especially knowing that you worked with Dr. Fauci.
Mhm. You know what I think it's really important for people to know, because I tell this to all of like I was in charge of the fellows, which is like people who are becoming hemonc people, and I love to teach people. But I think it's really important for people to do what they love. And so if you have to change what you're doing, that's fine, because life is really long. So you might as well be doing something that you love.
Exactly.
Like, I don't know this other fun little tidbit, but I started out in OBGYN and then I switched to pediatrics. So,
Yeah, and that's the thing. Like, if you have something that you want to do, all you have to do is just really work for it and
Mhm.
find what you love, find what you would like to do for the rest of your life. And that's definitely like a powerful message in general. Um, Now, this is again a little bit off topic we were just talking about.
Mhm.
Um, in your spare time when you're not doing all this amazing work, what do you like to do for fun?
Um, I love to be with my family. So, because, my husband still lives in Cincinnati with my youngest child. So I love to be with my family, and we are outside people. So I love to garden. So that's where I relieve my stress, is by gardening. My husband and I love to bike. So we also love to swim, take walks with our dogs. So that's what I like to do in my spare time.
Yeah, and my dad and I actually garden together. We have like I think one, two, three. We have four like of those big like box gardens where we do like
Oh yeah, those are great.
fruits and herbs, and it's just something really fun to do during like the
Hmm.
spring and the summer and like the beginning of fall because you're able just to go out there and almost just like relax. So I can definitely
That's
relate to you on that.
that's right.
Now, I like to ask everyone that I interview this question. If you had a magical superpower, what would it be and why?
Oh my goodness. Um, if I had a magical superpower, what would it be and why? I think I would like a healing power, like a healing power like Harry Potter, like some sort of wand that would tell me what someone had and how I take care of it.
Wow, I really like that because I haven't heard anything like that yet. I've heard of wanting invisibility and time travel. I've heard many things, but that is something new and I really like that.
Thank you.
So, before we end our interview, is there anything additional you would like to share with our viewers today that we did not cover?
No, I don't think so. I think you did a wonderful job.
Thank you. Well, I can't thank you enough, Dr. Adams, for taking the time out of your very busy schedule to speak to me today about this incredible work you are doing. I just want to say again how very grateful I am to have access to the Comprehensive Vascular Anomalies Program at CHOP. Being a teenager with a condition like this can sometimes be hard and a little confusing, and I am so thankful for all your attention and care. You always make me feel like I am more than a birthmark. So thank you so much. And honestly, I hope to see you soon. Thank you.
Yeah, so we should talk soon, okay? So we should talk about all the things that I was talking about at the beginning of the talk, okay?
Thank you.
All right, okay, bye.
For more information about the Comprehensive Vascular Anomalies Program, or CVAP, at the Children's Hospital of Philadelphia, please visit their website at www.chop.edu or call them at 267 426 9188. You can also donate to CHOP by clicking the Make a Gift link to help with treatments and the incredible research collaborations we discussed today.